Hello, everyone, and welcome to this first webinar of Migraine Canada, addressing the causes of migraine. My name is Dr. Elizabeth Leroux. I'm a headache specialist, and I work in Montreal, Quebec. I hope you will enjoy this video, and welcome. So why am I giving this talk? Well, one of the reasons is because over 10 years of practice, it's not rare that I meet someone who's been living with migraines since the age of 12. And when I ask this person, what do you think migraine is exactly? What is going on during a migraine attack? They tell me nobody ever told them that. And they've been living with this condition for years and years without really understanding what is going on. Migraine, as we will see, is actually invisible. And this contributes to the stigma that is an additional suffering for people who live with migraine. And the stigma also leads to a lack of treatment or a lot of misconceptions about treatment. So by discussing the science of migraine today, I really hope that I can help you understand better what migraine is and that you can share that with your networks and your healthcare providers. If you live with migraine, probably you've heard those things before. You should drink more water. You should manage your stress. You should give up on chocolate. And God forbid we would have to give up on chocolate. It's so good, isn't it? So what about these advices? Are they helpful? What are they based on? Of course, it's reasonable to be hydrated. Of course, it's reasonable to manage stress. But is it enough to control migraine? Another thing that can actually happen if you have migraine is you will start looking for improvement, and then you will meet a lot of different professionals or different firms and companies who pretend that they know the unique cause of migraine and they have a perfect tool or a perfect thing to address it. They have the migraine cure. So that might be a miracle diet, that might be a procedure, a piercing, that might be a special supplement. And sometimes these people or these companies really want to help, of course, but some of them are actually more interested in the profit they can make. So it's not always easy to understand what those treatments are based on. And I think as a person with migraine, every time you hear something like miracle cure or works 95% of the time, you should be very careful and put that in the same list as lose weight without doing any change to your diet or make money while staying at home. So be very careful about these. But as we will discuss, it doesn't mean that all alternative medicine options are not fitted for you. It just means that be careful when someone tries to sell a perfect option for migraine. It's also very important to talk about migraine because it's so common in the human race. A lot of my patients say that they feel alone. They feel that no one understands them, which is funny really, because migraine is the third most common problem or disease in the whole world. So bring it, malaria, tumors, cancer, everything. Migraine is the third most common. The first one, if you're curious, is dental caries. The second one is tension type headache, which is closely related it's also a headache disorder, so it's kind of related to migraine as well. So migraine is common, but you could say, well, a lot of people with migraine have a few migraines per year and they're not that disabled. It might be true, but 1 to 2% of the whole world lives with what we call chronic migraine, which is having migraine or some related headache more than 15 days per month. So that's very disabling. And that's 1 to 2% of the world's population. So we definitely should talk about migraine more in this society. Okay, so topics for today. I will not talk about particular treatments today. I really want to start at the root of it, at how your brain works and why migraine occur. So we'll talk about genes and the migraine software. We'll talk about the migraine pain and the cascade of migraine. We also will discuss what I call the ping pong theory. It's how the migraine brain interacts with the environment. And then we'll talk about triggers and thresholds. Then we'll just put all this together and then move to an overview of treatment. So now that we will understand what migraine is, well, how could we treat it? We will have an introduction to the migraine tree, which is our key resource for information on our Migraine Canada website. And then we'll finish with just a little note about how important it is to change the system in Canada to serve people with migraine and other headache conditions better. Are you ready? Are you curious? Let's get started. Society should get this. Nobody in their right minds would say that coughing or being a bit out of breath is the same thing as living with asthma. So I really hope that someday people will get that having a headache is not living with migraine. Coughing and a headache are symptoms. They can be caused by a gazillion things. Asthma and migraine are chronic conditions that can be disabling and may require medical therapy. So hopefully every time I go in the media, I'm asked the same thing. What's the difference between a headache and a migraine? And I hope someday people will get it and understand that a headache is a symptom and migraine is actually a medical diagnosis. So what is a migraine attack? Well, when you see a doctor for a headache, well, the doctor will start by ruling out dangerous things by different questions and about your symptoms and how it happened. And then if to diagnose migraine, they will start with questions to see if your symptoms fit into a migraine attack. But the key thing is that a migraine should be recurrent. If you have, for the first ever time, a headache, even if this headache comes with nausea or light sensitivity, which are typical symptoms from migraine, a first ever headache should never be diagnosed as a migraine because it can be something else. It can be a tumor, can be an infection. So if you have, or if you live with migraine and you have a new headache, just be wary and seek medical advice. All right. So you have recurrent attacks. And then you have a bunch of symptoms depending on which part of the brain becomes affected. So the typical migraine headache may start on the one side and might be pulsating. But a lot of people actually have headaches in the end on both sides, and not all of them report that the headache has to be throbbing. So it's possible to have a migraine that's both sides, especially in kids, and not throbbing. And then the migraine has to be moderate to severe. So it has to slow you down or to be somewhat disabling. But there are different severities of migraine. Some of them are terrible, flamboyant. They put you on your back for days. Others are maybe more moderate. It has to last more than 4 hours. So the key point here is to differentiate between a tension headache, which is super common, a little headache like a helmet or a cast. You don't have any other symptoms with it. It goes away usually, and it's not usually disabling. And then you have the other symptoms of migraine. We call them sometimes the cardinal symptoms of migraine. Gastrointestinal stuff, nausea, vomiting. Some of my patients complain of diarrhea, something going on with the gut and the stomach. Sensory hypersensitivity is huge. Sensitivity to light, to sound, to smells, very typical. And then to movements and touch, having the skin hypersensitive. And then some of people with migraine actually have auras. I will talk about them a little more. And then there are symptoms that are less common maybe, or less official, but a lot of people talk about them. Dizziness, feeling unstable, vertigo, and then all the other pains, neck pain, sinus pain, jaw pain. We'll talk about that. Skin hypersensitivity. And then everything that relates to what we call the higher brain functions. That's what your brain does when it has to compute information. So having difficulty focus, finding words, having difficulty concentrating. And so people sometimes talk about brain fog to kind of define this. Irritability and fatigue is big, especially after the migraine attack. People may feel exhausted. So it doesn't mean that everyone with migraine has all of these, but they mix and match. And usually people may have 2 or 3 different types of attack and may have those symptoms. So we're really more than a headache here. So migraine, the problem is it's invisible on CT scans and MRIs. Medicine relies a lot on imaging these days. We do imaging for everything, for the heart, for the kidney, for the brain, name it, you just MRI it. The problem is that it works well if you have a brain tumor. So this here, you see the big bad tumor, and it relates to the computer that is visibly broken. But with migraine, we're talking about a software problem. So it's all about a computer that seems to work. You know, it looks nice, but then you start it and it might actually be slow. The programs might not run, and it looks like a normal brain. It looks just fine, but it doesn't work very well. So can you imagine something else that you can't see but does exist? I would say the Wi-Fi is a good example. It's also a kind of an electromagnetic thing. We use the Wi-Fi every day. I'm using it right now. And we don't see it, but it still does exist, right? So I think we should just go a bit beyond saying that if you can't see it, it doesn't exist. Remember, in old days, epilepsy was supposed to be a demonic possession because we couldn't see it until the EEG. And in the old days, there was a lot that couldn't be seen, like infections and bacteria and viruses, and people thought it was in the air. So we really have to be careful before discarding something just because you cannot see. So, okay, so what is the cause of migraine then? What can we actually scientifically say about it? To understand that, we have to discuss what is a gene and what is a protein. We have to understand how the brain works. So a gene is a bit like a cookbook, a recipe from a cookbook to build proteins, a bit like Legos. All our bodies are made from proteins, and those proteins are encoded by genes. All humans have similar genes, but different versions, just like recipe. You know, your recipe for spaghetti sauce is not the same exact recipe as your grandma's. So genes are really ways to build proteins in our body. How does the brain work? We could, you know, some people spend their lives on this, but just let's make it very simple. Our neurons who talk together, we have like gazillion, trillion neurons. They speak together and they determine how we behave, how we perceive, they integrate tons of information. How do they communicate? They communicate through electricity and chemistry. For chemistry, we have what we call neurotransmitters that are little molecules that bind to a receptor. So it's a bit of a message that finds the right mailbox to make the other neuron do something or behave differently. So we have chemical substances binding to receptors and influencing the way that the neuron behaves. The electrical current may actually lead to the release of those molecules, those neurotransmitters, and they may also influence, neurons can also communicate directly just with electrical messages. And all of this is not visible to the naked eye or even the MRI. Okay, so we have our genes, our proteins, and that determines our neurotransmitters, our receptors, but also how our blood vessels work. And blood vessels are very important to keep our brain well fed and well functioning. So blood is a bit like the fuel or the electricity, if you want, that keeps the computer working. So that's how your brain works. But it gets very complex. I'm just showing this slide here to say that we actually get a lot of information about the brain and a lot of proteins there. So the level of complexity of a neuron, it's not like an A or B switch. It's like a little town with all kinds of people talking together to make a decision. So neurons are very, very complicated structures. Okay, so how can we observe the brain and understand what's causing migraine? So that's the thing, right? So we just said that the MRI and the CT scan is not very helpful. We just see a normal appearing brain. We can look at the genes, and there's been a lot of genetic studies. We can look at chromosomes and so on. And this tells us which genes are linked with migraine. So we actually know some genes that are linked with migraine. We can also look at the electric activity of the brain with different recordings. We can look at the chemical activity of the brain by dosing products, measuring different substances like neurotransmitters. That's what we call biomarkers that we can measure. And we can also do something pretty cool, which is functional MRI. So that's putting someone in the MRI machine and then ask this person to do or think about something. And then we see that a zone in the brain lights up, gets more blood. And that should mean that something is going on during that time that necessitates the blood, requires the blood in that zone. So by doing this, we can say, okay, that zone must have something to do with whatever is going on. Okay, so what is going on around the world to study migraine? Well, many teams use those techniques and become expert at using them. One example is the human model that they use in Denmark. So in Denmark, they actually have a center where they can take volunteers, people with migraine or people without migraine, and they inject them with different substances that can trigger a migraine attack. And then they kind of record all kinds of things. So the blood vessel reaction, the blood pressure reaction, and they can also put them in the fMRI machine and see if they get a migraine attack. So that's a very interesting way of proceeding. Okay, so we said that the migraine brain is different from other brains. And this is what the researchers found out. For example, in the chemical world, we know that the migraine brain has a lower serotonin state, and that during a migraine attack, serotonin actually just spikes. On the electrical side of things, we know that migraine brain does not habituate. What does that mean? It means that if you take a normal brain and you flash a light to this person, the brain will eventually say, okay, I've seen you light, it's okay, I'm gonna dim that out because it's not relevant, I'm going to ignore it. The migrainous brains do not do that very well. They keep responding, light reaction. So that's what we call a low habituation. And that probably has consequences on how the brain works, of course, because everything is always very important, lots of input and no moderation. It might also influence the way the brain manages energy. Let's talk about the aura. Some of you might have what we call an aura. An aura might be a symptom of vision, seeing zigzaggy lines, flashes of colors, losing vision. Usually it's progressive, so starts small and then grows bigger. I'll say a bit more about the symptoms in a sec. But the cause of the aura is a wave of electricity on the surface of the brain. So on this slide, you can see in red, that's kind of the wave where the neurons just fire and fire and fire. And that moves, the neurons it's like dominoes, it communicates. And then after the wave passes, the neurons are stunned. They just fired a lot, and so they stop working. They're a bit in a daze, if you want. So during that phase, those neurons stop working, and that leads to symptoms. So where the wave goes, the symptoms occur. So typically, an aura is often a visual thing, and I'll show you some example. But it can be, for some people, this crawling numbness or tingling that goes along your arm and face. It can be, for some people, difficulty speaking, difficulty understanding. And in extreme cases, people can even paralyze with an aura if the wave goes to the zone of movement in the brain. That's what we call hemiplegic migraines, very rare. It's usually genetic, and that can actually be very, very scary. So think of the aura as a wave of electricity causing symptoms. Here are some drawings of visual symptoms of the aura. It's very diverse because the visual part of our brain is very, very complicated. So it can be one side or two sides, can be colored, it can be black and white, can be lines, can be dots. So if you have auras, you can discuss with your physician. Usually they look alike and they repeat. But some people have auras and they never have migraines. So the aura is something that can exist even in non-migraine people in their 50s often. So the aura is something that's very genetic. It's a wave of electricity. We understand it, but not everyone with migraine has it. So now we get back to this idea that genes produce proteins and that every brain works a little bit differently. And that actually influences also the susceptibility to aura. There's a lot of people with aura in their families. There are others that have aura. So the aura is very, very genetically influenced. Okay, The nice thing with the aura is there's actually studies where we can see the electrical wave. We can actually observe it. So can we see the migraine attack? Not the aura, just the migraine attack. And I'm delighted to say that now we can actually see things happening in the brain with advanced techniques.